Hey class, welcome again to another session on biomaterials. So we are inching towards the end of our syllabus and let us start discussing the fifth unit, which is testing of biomaterials. Now, you would ask a question like, obviously when you are like manufacturing an implant, you would have taken into considerations the factors such as biocompatibility, bioinertness, immunological reactions, and etc. Right? Everything that we studied in the first unit has to be taken into consideration while developing an implant, right? So why do we need additional testing is a question that arrives in the mind often. Well, we do require additional testing is because often we do not use exactly the same material as like for example, what I'm trying to say is, if you take polymer for example, right? So often characteristics of the polymer is modified such that it closely resembles the organ that it is going to replace. Now, during this modification process, sometimes, not always, but sometimes, the properties of the material can get slightly modified, and this slight modification can cause a havoc inside the human body. So, in order to rule out any such adverse reactions, we have to make sure that we test the material. The actual material that we are going to use to fabricate the implant should be thoroughly tested, and once during fabrication of the implant process as well, sometimes you apply heat to change the shape of the polymer. Like it is, if it is solid material, then you often heat it, melt it, and pour it in scaffolds to get the desired organ shape. So while heating and then while coming in contact with the scaffold material, and sometimes heating a material to its melting point and then bringing it back to solidification can also change the properties. So therefore, once you have like completely manufactured the device, you have to test it again. And these are list of tests. Main tests that we are going to concentrate in this unit is the biocompatibility test. We also have certain in vitro and in vivo tests, which we will also discuss in this session. And finally, the sterilization procedures that are used to evaluate the to make sure that the implant is free of any impurities or free of contamination, and then the packaging and transporting is also vital. So let us have a discussion now. So the safety tests performed on a medical device is governed by the intended use, right? So where exactly are you planning to use the device, or where exactly does the manufacturer say that this device is supposed to be used? That matters. The packaging matters, because you should pack it in such a way that you put the device as a sterilized product, and then while you open, the sterility shouldn't get compromised. It shouldn't be such that you open and then you have to put your bare fingers inside the packet, and that would jeopardize the sterility. The packaging should be such that the sterility doesn't get compromised, and then the sterilization procedure used as well. Sometimes heat is used for sterilizing a biomaterial. In those scenarios, you have to make sure that application of heat does not modify the properties of your material that you have used, because any modification in the property means there is chances of the body rejecting it, right? So also, why are we so particular about the safety? Is it just for the patient? No, it is for anyone who's handling the device. See, patients are vulnerable, we know, because they are fighting some certain illness or certain conditions because of which they are requiring that implant. So obviously they are quite vulnerable. However, the healthcare professional, say the doctor or the nurse or the compounder or anyone, you who handles these devices day in and day out, are in constant contact with the medical device. So they are at risk of infection as much as your patient is. So safety has to be general safety of the patient as well as general safety of the person handling the device. So the category of tests performed for any medical devices can be in 3 steps. First is you have to first and foremost you have to make sure that the device is not toxic. Like every time you touch the device, toxins are not leaching inside your body. So similar tests such as that. So toxicity has to be removed, and then you have to make sure that your biocompatibility tests such as contamination test, radiation exposure test, etc. need to be performed. And finally the packaging and the transporting tests are also vital, because no matter how sterilized your device is at your manufacturing unit, if while transporting and packaging the device gets contaminated, then the purpose of sterilization is totally compromised, right? So you have to make sure that once it is coming out as a sterile product, it has to be it should remain sterile till the person at the operation theatre or till the person at the hospital ward opens the packaging and tries and uses it on the patient. Now this can be any medical device that you use. It can be something as simple as the gauze pad that is used to apply medication. So these rules apply for any such devices. We shall discuss these further in the next video, because I think I'm running out of time at the moment. I shall see you in another video. I hope you take care till then.